Welcome to the StellaLife Innovator Series. I'm Liz Lendry, the Clinical Education Manager for StellaLife. Today, we're featuring biological dentist Dr. Sylvia Zannis, who practices at Well-Rooted Dentistry at the Biomed Center of New England. In biological dentistry, doctors use an individualized approach to treat the causes of dental disorders. And when they provide treatment, they do so holistically with biocompatible materials. Today, our guest will share her journey in this emerging field. Let's welcome Dr. Sylvia Zannis.
So, dentists are typically viewed as a place where patients go to have a cavity filled. It's a place where patients go to get things fixed after something has already happened. So this is a very reactionary approach. Many patients I've had previously would come to the practice, we would do our exam, we would take our x-rays, and they would have a new cavity. And they say to me, listen, I'm doing everything right at home, I'm brushing, I'm flossing, what more can I do? And this is when we kind of have this paradigm shift of, okay, let's take a more functional, comprehensive approach. Maybe there are underlying factors going on. And then we really can dive into patients and discuss sleep disturbances, nutrition, genetics, lifestyle factors, because all of these things play a huge role in that oral systemic health. So my introduction to biological dentistry came from a patient that was having a delayed hypersensitivity reaction to a material that was placed in her mouth. She was having symptoms that were really affecting her day to day. She was having chronic fatigue and brain fog. She was also having some acute symptoms near the site of this material. So she had a material biocompatibility test completed and learned that she was allergic to this material. So we removed this material safely for her. And in her own words, she got her life back. This was an absolutely incredible story, and it got me interested, and I started researching, and I realized you don't know what you don't know. So, when we go out to eat, the server typically will ask you any allergies at the table. This is a concept that we should really start asking our patients. About 17% of the general population has a nickel sensitivity, and this is a material that is commonly used in dental materials. So good health begins in the mouth, and understanding that as a dentist, we have a huge opportunity to prevent many diseases. And for the most part, almost all of dental diseases are preventable and they are chronic. So chronic meaning that they happen over time, that you don't wake up one day with a cavity or with extensive bone loss. So by the time that we see symptoms of bone loss and cavities, there's been possibly an imbalance of minerals and bacteria in the mouth. Maybe there's absorption issues. So we really aim to get to the root cause. There are 3 steps in chronic inflammation. The first is a regulation disturbance. This can be a hyperacidic environment. This can be a nutrient deficiency. This can be inflammation, influx of toxins, allergens, bacteria. This is a step that as a biologic dentist that I aim to treat or remove any interferences that would not allow a patient to live optimally. The second step to chronic disease is a functional disturbance. This is when we start to see impaired cell division, an imbalance that the body cannot compensate for. And then we have this third step. This is an actual structural disturbance. This is when we are starting to see symptoms in patient. This can mean a cavity. This could be tumor growth. We see vessel wall occlusion. This is the step that, as a general dentist, that I was previously treating. But if I'm only treating that cavity, well, what about, we're kind of missing the big picture of what else is going on. So we're really taking an individualized prevention approach. And I think the biggest way between how I used to practice and now this more functional, individualized, comprehensive approach is just understanding that in medicine, dentistry, lifestyle, it's not a one size fits all. And going through all these different factors with a patient are really important to, not only getting them out of pain, giving them a beautiful smile that they can be confident with, but really optimizing their oral health, which in turn, plays a huge role in your systemic health.
Thank you, Dr. Zannis. At StellaLife, we applaud all our clinicians across the U.S. who provide our award-winning all-natural products for accelerated healing, pain relief, and non-toxic antimicrobial action. StellaLife will be at RDH under one roof. We're really excited to be there and invite you to come visit our booth for a special gift and to try our new coconut rinse. We're looking forward to seeing you there. And until next time, stay healthy, stay safe, and stay happy.